My son has a small hole in his heart, and it developed a small aneurysm. And it wouldn't have been discovered except that in Russia, where he was adopted from, they do testing of orphans, and so his condition was actually discovered, whereas it would probably have been asymptomatic. Oftentimes they appear typical, and so you may not always know that a child has a heart difficulty. So it's important to support research and intervention and all of the fundraising that's done, because there may be many children that they know that have heart conditions that they don't even realize have them. And there's also, I think, especially in cases where heart conditions are more severe, I think there's definitely a sense among parents and kids about really preserving every moment and enjoying it to the fullest.
My son's name is James, and he is going to be 7 in September 27th. He was born with a complex heart defect called double outlet right ventricle. Basically, that means that his left ventricle didn't grow at all. So he has so far survived 3 open heart surgeries, one at 6 weeks, one at 9 months, and on his 3rd birthday was his 3rd one.
1, 2, 3, 4, 5. On your back, belly up.
So right now he's doing great. Like I said, he'll be going into 1st grade, and he's going to be 7 in about a month. He's just about like any other normal boy, except that he just gets tired a little quicker, and that he just needs to take breaks more often. But he's been in gymnastics, and he really likes to just play golf and just be out there collecting snakes and bugs. He loves that. So.
But Dad needs a sticker. Go grab it. There's another one right over there, buddy. Grab Dad a sticker. It's Thanksgiving blood today, Dad.
Well, the blood drive is a product, because without the blood, when our kids were having our surgeries, I mean, they wouldn't have made it. They've had blood transfusions post-operatively to get their hemoglobin levels and everything back up, and then obviously life-saving blood transfusions during the surgery. So it's something that you can do. It doesn't cost anything to give back and help other people that may need it, other kids, other adults, other people under many different circumstances.
Donor dollars that are spent through the American Heart Association, they affect both children and adults. And a $100 donation can help heart patients' families learn how to do CPR. It can they'll donate AEDs to area churches or schools. And it's not just the research, it is on helping the caregivers that are taking care of people, whether they be children or adults, taking care of the people that have the heart disease, learn how to help them, whether it be education with learning how to cook healthier, how exercise affects the heart and what they need to do to make it better. The Heart Association deals with all of those things.
When we found out that Stephanie was pregnant, 4 months in, we went for an ultrasound to find out if we were going to have a son or a daughter. And it was then that we found out that Jack had had an issue with his heart. They were during the ultrasound. We didn't realize it, but it took a little bit longer than normal, and they kept looking and looking, and they were just saying they were trying to just make sure they see everything. And then it was about a day later that we got a call from the doctor, and the doctor said that Jack had a rare heart condition known as HLHS, which is hypoplastic left ventricle heart syndrome. And it was then and there that our lives changed. But we did our research and we figured out what we were going to be up against, and we continued to deal with it and fight against it. And on May 28th, 2007, Jack Carl Hartman was born. And he was born with only basically half a heart. The left side of the heart did not develop. And after seeing him for a couple minutes, they took him away at Children's Hospital Milwaukee, took him down to the NICU where he spent a few days down there. And it was, I think, on his 10th day of life that he had his first open heart surgery. And since then, before he was 3, Jack has had 3 open heart surgeries to help his condition. You know, from there, he's grown to be 6 years old, and he has the joys of any other normal little boy. The things he likes to do, he's in 1st grade. Jack likes to play golf. He likes swimming, likes to throw the ball around the yard, ride bike. So, I mean, he has normal activities like any other child. Jack was bitten by golf a couple years ago, and he enjoys it. He likes the instruction. He likes to learn. He's very, very attentive, and he wants to get better. And when he gets shown something, usually he remembers it. And when we go out and practice and we play, he'll always bring up what he's learned in the past. 20 years ago, 25 years ago, these children were known as blue babies. They would go home, they would turn blue, and they would just pass away at home because the heart would stop working. You know, it's through the research and the donations, along with the American Heart Association, that helps the doctors in the hospital be able to perform these surgeries and to continue to research and to find cures. I do believe the oldest living person with Jack's heart condition is like 26 or 27 years old. He's going to need a heart transplant somewhere down the road. The heart he has in his body will not last him his entire life. So basically, when these kids are born with this condition, it's a terminal condition. It's a terminal illness that they have. So they will definitely need a heart transplant somewhere down the road. Jack is my hero. He's 6 years old. He's tougher than any kid I've ever met, and tougher than any person that I've ever met in my life. And I say this, and I'm 51 years old, but I hope someday I can be as tough as he is, because what he's been through in his first 6 years of his life is more than most people, 3 or 4 or 10 people will go through in their entire lifetime. And he's a fighter, he's strong, and it's like I said before, it's through the donation dollars that we get for the American Heart Association, through the research, through the doctors and nurses at Children's Hospital, that we're able to have Jack here with us today. And it means a lot. It means a lot. So, you know, do what you can do to help out, because it's a great cause and it's supporting great kids.
Full swing. There you
Look
go.
at that.
Whoa!
Good job, buddy.
Yeah.
That went so far, it went all the way over there.
You want to come up here?
Yeah.
In my hand. Got it? There you go, buddy.
Hey, what am I